Welcome to the EADV podcast, the official podcast of the European Academy of Dermatology and Venereology. I'm Adriana and I'm your host. Every month, the JEADV chooses and highlights 4 articles in a section called Editor's Picks. Today we explore the Editor's Picks for December 2023. Searching for an alternative to Kligman's trio, searching for consistent evidence in the prevention of atopic dermatitis using moisturizers, is there a link between acne and depression, and Dermatoporosis, a French observational study. But before we get into that, if you haven't already, check out our program of face-to-face courses offering high-quality theoretical and practical training covering a wide variety of specialties. Applications have already opened for courses for 2024, including paediatric dermatology and infectious diseases for nurses in dermatology. Places fill out fast, so subscribe to our mailing list if you'd like to be the first to receive news of when courses go live. You can learn more at eadv.org. And now, the editor's picks. Article 1. Searching for an alternative to Kligman's trio. Kligman's trio, first reported in 1974, remains the gold standard approach for treating melasma, a common hyperpigmentation disorder affecting about 1/3 of females. However, the use of hydroquinone as a cosmetic agent is not permitted in Europe due to safety concerns. A 24-week prospective randomized controlled trial was conducted to assess the efficacy and tolerance of a new triple combination cream containing thiamidol, retinoic acid, and dexamethasone acetate to treat melasma compared to Kligman's trio, both applied once daily along with photoprotection. The researchers found that the new combination cream demonstrated potent efficacy and significant improvement in the quality of life of melasma patients with good tolerance. While the primary endpoint, the Modified Melasma Area Severity Index, did not reach statistical significance, the numerical difference indicates a clinically relevant improvement. The authors propose that this new cream represents an effective alternative to Kligman's trio in melasma treatment. Article 2. Searching for consistent evidence in the prevention of atopic dermatitis using moisturizers. Early life interventions are implicated in the literature as important in the prevention of allergic diseases such as atopic dermatitis. However, a recent Cochrane review reveals inconclusive results regarding early skincare interventions to prevent AD. Inyuzuka and colleagues suspect that such inconsistent findings may be due to varied practices from emollient types and frequency of application to adherence. The authors conducted a novel head-to-head randomized controlled trial, the PAF study, examining the preventative effect of moisturizers currently available in Japan by type and frequency among neonates at high risk of developing atopic dermatitis. The emollients were to be applied until 32 weeks of age or at atopic dermatitis diagnosis. The incidence of atopic dermatitis was 55%, twice daily emollient, 25% once daily emollient, and 50% once daily control emollient in babies with a family history of AD. The study suggests that the effectiveness of moisturizers may vary according to the type and amount applied. Interestingly, in one group, the onset of atopic dermatitis was delayed by 50 days, indicating a clinically meaningful effect in terms of food allergy prevention which merits further evaluation. Article 3. Is there a link between acne and depression? Many observational studies have shown a controversial relationship between acne and depression. A 2-sample Mendelian randomization study using a promising method for causal inference was conducted by Lee and colleagues to explore the possible genetic causal effect of acne on depression in order to overcome restrictions in traditional observational studies. Such a study design allows for simulation of randomized controlled trials in observational settings and investigation of the independent effect of acne on depression, overcoming the interference of drugs and increasing confidence and validity. No causal association between acne and depression was found under Mendelian randomization assumptions. Nevertheless, the authors mentioned that genetic differences could have existed between the cohorts. They hypothesize that even if genetics are not the root cause, the stress level experienced in adolescence could be a factor. Indeed, a more detailed genome-wide study is necessary to explore any impact of depression on acne and vice versa. Article 4. Dermatoporosis, a French observational study. Dermatoporosis was first proposed in 2007 by Kaya and Saurat as a way of grouping the syndrome of skin aging manifestations that are both cosmetic and functional. Clinical aspects include skin atrophy, pseudoscars, and senile purpura. They intended that, like osteoporosis, dermatoporosis should be prevented and treated to avoid worsening. In a prospective observational study by Truchete et al. Among older adults in eastern France, a high prevalence of dermatoporosis was found along with a male predominance, a male-female ratio of 2.5. Based on multivariate analysis, elderly people with comorbidities and multiple medications can be considered to be a prototype of individuals at risk of dermatoporosis. The authors advocate that awareness of this condition is necessary to prevent and detect potentially severe complications through a multidisciplinary approach. To recap, our first article was Efficacy and Safety of a Novel Triple Combination Cream Compared to Kligman's Trio for Melasma, a 24-week double-blind prospective randomized controlled trial by Berthold and co-authors. Our second article was Prevention of Atopic Dermatitis in High-Risk Neonates via Different Types of Moisturizer Application, a randomized, blinded, parallel 3-group Phase 2 trial by Inuzuka and co-authors. Our third article was The Association Between Acne and Depression, a 2-sample Mendelian randomization study by Liu and co-authors. Our fourth article was Prevalence and Comorbidities of Dermatoporosis, a French prospective observational study in General Medicine Consultation by Truchete and co-authors. Naturally, all of the research presented today can be found in the Journal of the European Academy of Dermatology and Venereology, and although you can find free access and open access articles, JEADV members benefit greatly by having access to all articles and content. We'd like to give a special thank you to all of our listeners, and if you haven't already, make sure you subscribe on Apple Podcasts, follow us on Spotify, or otherwise you can find us on any major podcast provider. It really does help us. We appreciate you joining us and look forward to presenting more interviews, research, and other topics of merit. And until the next episode, take care of your skin.